Okay, well, let's go ahead and get started. And we're going to start with the same question we start with every week, and that's we want to know how many positive patients are in the county, how many are here with us at Kaweah Delta, how many inpatients we have awaiting results, and of course, the sad part is how many have died in the county and how many have recovered.
Great. Okay. Well, thank you, Deb. Always making a point just before I come over here on Thursday afternoon to stop by the command center where we have literally across the entire east wall kind of a running statistics profile of what it looks like at Kaweah Delta as well as at the county, and just always a big shout out to Carrie Nowitzki, who is doing some phenomenal work in the command center. Just an amazing person. She just recently, a little begrudgingly, but I gave her a nice gentle support shove. We put her out there in the limelight, so she's done some television interviews recently and has done a phenomenal job. So, but Carrie always makes certain that I have the most up-to-date sense of what's going on. So as of yesterday, there are 352 positive cases of COVID-19 throughout Tulare County. And sadly, as Deb just referenced, 15 Tulare County residents have passed away because of the COVID virus. Countywide, there are almost 460 people that are quarantined at home right now and are being monitored by the county. They're checking in oftentimes 2 times a day, again checking to see how their symptoms, if they're appearing, or just how they're feeling in general. So of the 352 positive cases in Tulare County, 148 of them have come from Redwood Springs, the nursing home. So Redwood Springs accounts for almost half of all the positive cases that have been identified in Tulare County. Of those 148 from Redwood Springs, 101 of them are patients, and 47 of them are staff members. And again, sadly, 8 of the 15 deaths that we've seen in Tulare County were Redwood Springs residents. 3 of them did pass away at Kaweah Delta Hospital. We currently today have 21 skilled nursing patients that are actually in our hospital right now and have been admitted as inpatients. 19 of them came from Redwood Springs, and 2 are now from Lindsay Gardens, which unfortunately there has now been a breakout there at a lower level than what we saw at Redwood Springs, and we hope it stays that way. But I believe the county reported last night that they have 11 people that have tested positive at that nursing home. I don't necessarily have the breakdown between patients and staff. And of the 19 Redwood Springs residents that are currently at Kaweah Delta, 10 of them have tested positive. So we actually have 9 of the patients that are in-house but have not tested positive. And so many of our patients, throughout the year come from nursing homes that obviously tend to be elderly patients, many of them with underlying health conditions, and they frequently are transferred from a skilled nursing facility to Kaweah Delta to have whatever their particular condition is diagnosed and treated, and then they go back to the nursing home. So not uncommon that we would have still patients from Redwood Springs that would not be positive. In total today, we have 23 patients that are in-house. Again, a number of them from the nursing home, but that have tested positive for the virus. And the majority of them are on 2 South, which I've shared with you in the past, is the dedicated 29-bed unit that pretty much now has all of our COVID patients are on that unit. As I talked about last week, having the ability now in-house to do immediate testing, molecular testing, to determine if they're COVID positive or not, We literally, every single patient that now comes into the emergency department that we believe needs to be admitted to the hospital, we can test them right in the emergency department using the Abbott One Now platform. And it literally can tell us in as early as 5 minutes whether that patient is positive or not. So we learn right then and there in the emergency department if they're positive or not. If they're positive and they don't need critical care, then they're sent to 2 South, which this might surprise you, but it actually gives the staff even greater peace of mind when they know that their entire unit has positive COVID patients on it. So it was actually more challenging for them when they were taking care of patients that they didn't know if they had it or not. They were there for a rule out or some other respiratory condition, but now placing all the patients there literally allows them to now follow a very routine, well-determined use of personal protective equipment. So that's been good. Really, the Abbott test was a true game changer. And then we also have patients that are on 3 West, which is our intermediate critical care unit, and also in the ICU. Again, as of this morning, we had 6 of those 23 COVID positive patients that are in-house. Only 6 of them are actually on a ventilator right now that have been intubated to help them breathe. We actually have 30 patients that do not have the virus that are also on ventilators. But that's normal at Kaweah Delta. Again, patients coming in with pneumonia or having had cardiac surgery or just some non-COVID related event, injury or a disease or some condition that required that they have support, airway support through a mechanical ventilator. But that still leaves us 60 ventilators that are completely unused and ready to be put into service should that need occur. And then lastly, I've always given you every week just kind of an update on the testing that we're doing. So over on Floral Street, which is our specimen collection site, as of yesterday, we've now collected roughly 1,900 specimens. 167 have tested positive, 1,600 have tested negative, and we're still pending results on about 90 patients. So that's the current status as we speak here today, and I will continue to keep you updated in the days and the weeks to come.